The importance is it can affect both the mother and the baby. Growth restriction and low birth weight, preterm delivery causing prematurity, all these are the complications the baby has to face. A decreased efficiency to do work, they will be tired easily. Then their complaints of dizziness or lightheadedness or fainting episodes.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Good evening, dear friends. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. This is a talk show exclusively with the expert doctors of Al Hilal hospitals and medical centers. Pregnancy is a beautiful journey. One of the most common complications of pregnancy is anemia, which is a condition in which the body lacks enough red blood cells to carry oxygen. Untreated anemia may lead to complications in the mother and the baby. Today we will be discussing this subject with Dr. Nisha Parameswaran Nair from Al Hilal Hospital, Hith. She is a specialist in obstetrics and gynecology and she has an experience of more than 15 years. Doctor, welcome to the show.
Thank you for welcoming me.
So doctor, how do you describe anemia and why is it particular to know about anemia during pregnancy?
Anemia is defined as a condition where the hemoglobin in the blood is less than 11 gram percentage. Hemoglobin is a protein found in the red blood cells. This main function is to carry oxygen to different tissues. It's important because this anemia can affect both the mother and the baby. Why this anemia occurs is, in pregnancy there is increased iron requirement and the blood cell volume increases only 20%, but the blood volume increases by 40 to 50%. So the disproportionate increase causes disparity in hemoglobin increase. So anemia is more common in pregnancy. The importance is it can affect both the mother and the baby. So pregnancy, anemia is more common and more dangerous, so routine screening, treatment or supplementation with iron and folic acid is needed in pregnancy.
And doctor, how common is anemia among pregnant women in our region?
Certain studies say that the prevalence of anemia in Bahrain is 33.3%. Other local studies say that 1 in 3 women attending the antenatal clinic is found to be anemic. So that is the studies so far available.
Doctor, can you now explain about the most common types of anemia found in pregnant ladies?
The common types of anemia, the most common type of anemia found in pregnant women is iron deficiency anemia. As you see, that is a nutritional deficiency of iron because of the increased requirement of iron during pregnancy and lack of dietary intake or poor absorption of iron. Then comes the megaloblastic anemia, that is because of folic acid deficiency or B12. Folate deficiency is common because folate requirement doubles during pregnancy, and the intake and absorption also may be less. The other cause more common in Bahrain is thalassemia, sickle cell anemia. Then the least causes us chronic diseases, renal disease, autoimmune disease, like that.
Doctor, we would like to know about the causes of anemia. Can you please explain?
Yeah, like I said, the most common causes are nutritional deficiency. That is, it could be due to iron deficiency, folic acid deficiency, vitamin B12 deficiency, protein deficiency, or combined deficiency. Then comes the anemia due to blood loss. It could be due to increased parity and low birth spacing, decreased spacing during pregnancies. Then it could be due to bleeding, previous heavy menstrual bleeding in the pre-pregnant state. Then it could be due to any blood loss during the pregnancy period, or due to worm infestation. Then a decreased red cell production and occurs because of the chronic diseases like renal disease, chronic inflammation, chronic infections, like that, autoimmune diseases, like that. Other condition is hemoglobinopathies like sickle cell anemia, thalassemia. These are the common causes of anemia.
Doctor, what are the common symptoms of anemia that expectant mothers should look out for?
Yeah. Most common symptom is fatigue, that is decreased efficiency to do work. They will be tired easily. Then their complaints of dizziness or lightheadedness or fainting episodes. These are the most common symptoms of anemia. Others include people complain of shortness of breath, then palpitations, and severe anemia cases also complain symptoms like chest pain, edema always are seen. These are the common symptoms of anemia.
Doctor, once a pregnant lady experiences these symptoms, how can we diagnose she has anemia? What are the tests to be done?
See, examination and history itself, we get an idea whether she is more prone for anemia. Like in the examination part, when the patient comes to the OP, we always ask the history, that is whether she is having any previous history of anemia, she is having a history of thalassemia, sickle cell anemia, or family history of this disease, then her repeated pregnancies, then she is having fatigue, tiredness, dizziness, or any symptoms of anemia. All these contributes to history taking. Then when we look into the pallor, the signs we check, that is pallor, the facial pallor, the eyes conjunctiva will be pale in color, the tongues will be showing glossitis, reddish color, then angles of the mouth will be showing fissures or cracks, that is stomatitis. These are the symptoms. Then severe cases we can see here murmur, clinical examination itself, then edema will be there. Then coming to the blood test, the screening blood test we usually do is hemoglobin estimation. Hemoglobin level will be usually less than 11. We classify anemia into mild, moderate, or severe. It is 10.9 to 10 is mild anemia. Then it is 7 to 10 is moderate anemia. Less than 7 means severe anemia. Then comes the other test like iron depletions, iron store depletion. Serum ferritin is the most common test done for that. That sensitivity is more when it is less than 17. But Bahrain Ministry of Government considers less than 10 as iron store depletion. The other test we do in the pregnancy is G6PD deficiency, sickling test for sickle cell anemia, hemoglobin electrophoresis for thalassemia, then red cell indices, that is the 3 indices will be helping to classify the types of anemia. Then completes the iron serum test, serum iron levels. Then we also do the vitamin B12, folic acid level estimation if required. Then the last is, if needed, we do the peripheral smear also if we suspect any abnormal condition like malignancy or something, or to other types of anemia, we do peripheral smear.
So these are the tests to be done to diagnose?
Yeah. Routinely we do a hemoglobin estimation the first visit or booking visit, then 24 to 28 is the second time we check hemoglobin, and the third trimester we do the hemoglobin estimation. This is routine.
Now can you speak about the risks anemia poses to the mother?
The risk to the mother includes she can have more prone to infections. Anemic mothers are more prone for infections. She can go into preterm delivery, preterm labor. Then even a normal blood loss during pregnancy won't be withstanding during labor. So there is more chance of postpartum hemorrhage, need for blood transfusion like that. So overall the morbidity increases if a mother is with anemia. The coexisting other high-risk pregnancy, other risk pregnancy complication adds to the mortality also. So anemia causes this much risk to the mother. Then the usual symptoms will be there like fatigue, that decreased work capacity. All these are other symptoms.
And how can anemia affect the growth and health of the baby?
If the mother is anemic, the iron supplementation to the baby is decreased. So baby will be having growth restriction and low birth weight, preterm delivery causing prematurity. All these are the complications the baby has to face. So if anemia is not corrected, the baby will be neonatal anemia can happen. And studies show that the babies born with anemia have decreased motor and cognitive development, delayed. So overall, both the mother and the baby are at risk if the mother is anemic.
Now, what happens if the anemia is not treated before delivery?
If anemia is not treated before delivery, the mother will be having symptoms as I told earlier. She cannot withstand the normal blood, even the normal blood loss during delivery. There is more chance of blood transfusion and postpartum hemorrhage. And during puerperium also, there will be delayed wound healing, more chance of puerperial sepsis, poor lactation. So the the recovery time will be prolonged in the puerperium. So anemia has to be corrected. Then we usually advise the supplementation with iron and folic acid, that is 60 milligram elemental iron and 400 microgram of folic acid, at least during 6 months of pregnancy and extended to 3 months postpartum.
Doctor, can we prevent anemia during pregnancy?
We can prevent anemia by supplementing all pregnant women with iron and folic acid. As I told, WHO recommends 60 milligram of elemental iron and 400 microgram of folic acid for at least 6 months during pregnancy and extended to 3 months puerperium. This is for the supplementation, not treatment, supplementation. That is all pregnant women should take. Then of course about the diet. Diet rich in iron. Iron is available in two forms, that is heme iron and non-heme iron. The heme iron comes from animal source like poultry, chicken, fish, meat, eggs, etc. This is better absorbed, so bioavailability is less. And the other sources like green leafy vegetables, then nuts, legumes, lentils, they are also contain iron, but it is non-heme iron. So the absorption will be less because of the presence of phytates. So then folic acid is rich in leafy vegetables, citrus fruits, peas, beans, etc. Then vitamin B12 available from meat, milk and dairy products, eggs. Vitamin C rich fruits include citrus fruits, lemon, guava, amla and all. So patient should be aware of all these things, the vitamins and iron rich
in
foods.
their diet. And now can you explain about the supplements also?
Other supplements include vitamin B12 supplementation. Of course, all the women should be checked for vitamin B12 also. Vitamin B12 deficiency can also cause anemia. So if needed, vitamin B12 supplementation and correction of that. Then comes high protein diet.
So doctor, when is blood transfusion and hospital care needed for anemic patients?
Usually for mild to moderate anemia, we treat with oral iron. Oral iron is 3 times a day or 2 times a day depending upon the severity of anemia. If iron is not tolerated well and the hemoglobin is not increasing, we consider parenteral iron. These people require hospital care. Then coming to blood transfusions in cases of severe anemia, that is hemoglobin less than 7, blood transfusion is needed. So then during a labor we give blood transfusion if needed, or postpartum hemorrhage is happening, we give blood transfusion. These are the conditions we give blood transfusion. Another condition is severe anemic patients with congestive cardiac failure or like that, we give blood transfusion only. Then comes anemia complicating with other high-risk pregnancies like preeclampsia, multiple pregnancy. They also need hospital care.
You already mentioned about the supplements. So some women avoid supplements due to side effects. What is your suggestion?
So we can give them food tips. That is iron to be taken with water or with lemon juice or orange juice, because vitamin C increases the absorption of iron. Then iron should not be taken with tea or coffee at least 1 hour before and after iron intake, because of the presence of tannins, it decreases the absorption. Then milk and milk products should not be taken along with iron tablet because it decreases the absorption. Then heme iron means from iron from the animal sources are better absorbed, but non-heme iron from legumes, lentils, green leafy vegetables, nuts and all, now it's decreased bioavailability. So proper soaking of the nuts, we can increase the absorption, because the presence of phytates, now absorption is decreased. This can be avoided by either soaking, fermenting, germinating, like that. Then adding vitamin C to the iron increases the absorption of these iron also. So overall, along with this, we should motivate the patient to take supplementary iron. Of course, it can cause side effects like constipation or some people. This can be avoided by adjusting the timing or changing the preparation to ferrous fumarate or gluconate, because they are better tolerated by the patients. Then liquid preparations are also softer on the stomach, so that is also another way. Then motivating the patient to screen for hemoglobin, taking supplementation, adhering to the treatment if needed, all these are part of antenatal care.
And finally, doctor, what is your advice to the pregnant women watching our show regarding anemia?
My advice will be all pregnant women should be supplemented with iron and folic acid for the better health of the mother and also the baby. It's a supplement, not treatment. And you should be aware of the iron-rich foods and dietary intake. These are two essential keystones for the prevention of anemia.
Thank you, doctor. Thank you very much for being with us and giving us a lot of valuable information. Thank you once again. So viewers, as doctor said, anemia during pregnancy is common, but it's preventable and treatable. Till we meet again next time with a new doctor and a new topic, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.